Please welcome to the stage, Itay Mayer, Managing Director of Lumenis Vision.
Hello everyone from Brooklyn, New York. Thank you so much for joining us. Lumenis is a leading healthcare company. Throughout the years, we have invented many technologies in different areas in healthcare. Just to mention a few. 50 years ago, Lumenis, then Coherent Medical, was the first company to bring into the market argon photocoagulator to treat retina disorders. 30 years ago, Lumenis invented SLT for treating open-angle glaucoma and has changed glaucoma care ever since. 20 years ago, Lumenis was the first company to invent intense pulse light, IPL, for treating different skin indications. Today, we're here to announce more exciting news. Today, we're here to announce that Lumenis IPL device was granted a de novo approval by the FDA for managing dry eye signs due to Meibomian Gland Dysfunction. But we're not done yet. We're here to announce and to share more exciting news from Lumenis. We are also here to share with you our new IPL-based device called Optilight. Optilight is the newest innovation by Lumenis, and we want you to hear more about it. Let me introduce to you our moderator for the evening, Dr. Richard Adler.
Many didn't think it was possible. Many didn't think it could get better. Many didn't think Lumenis could shine the light any brighter on dry eye disease. But many were wrong. Welcome to Optilight. I am Dr. Richard Adler, your host, and I will be introducing you to the technology, to the doctors, and to the patients who helped to define this revolutionary new light treatment that we call Optilight. Optilight has taken IPL to the next level with optimal pulse technology designed to ensure an even, continuous, and comfortable application of energy to the delicate tissues around the eye, and with the OPT handpiece engineered specifically with the tricky contours of the periocular region in mind. Optilight has transformed IPL. With the inflammatory basis of dry eye disease now well established, and even a part of the definition of dry eye disease, and with many dry eye patients in our practice who just don't use drops well or who aren't compliant with their meds, we need other ways in our toolkit to address the inflammatory basis of this disease besides pharmacology. Tonight, you will meet some of the thought leaders, the pioneers and the experts in the world of Optilight, who will help us to better understand its value to our practice and to our patients. Dry eye disease is a multifactorial disease, and oftentimes multifactorial diseases require multifactorial treatment strategies. So, as you listen to this important program tonight, ask yourself the following questions. Is dry eye one of the most common conditions that you see? Do you have patients in your practice who aren't compliant with their meds? Do you like the idea of driving an additional revenue source around one of the most common conditions that you see? And do you like the idea of having an FDA-approved device in your practice, in your hands? If you're answering yes to any of these questions, don't go anywhere, because Optilight is on, and the room just got brighter. Wow, there it is, a culmination of the patient experience, physician feedback, and engineering brilliance. Amazing. It is an absolute privilege and honor for me to introduce to the stage our first expert. It is difficult to introduce him without using words like pioneer and trailblazer in the world of dry eye and IPL. He has trained hundreds, if not thousands, of doctors in this technology. It is a pleasure to welcome to the stage the founder and medical director of Toyos Clinic in Memphis, Dr. Rolando Toyos. There he is. How are you? Good to see you.
Great. Good seeing you.
What a big day here. This is a big day for you.
Yes.
Very, very exciting. I mean, Dr. Toyos, you have been there since the beginning of IPL time. You've watched the evolution of this technology go from anecdote to science to success, and now we have an FDA approval. Amazing. You were a part of the FDA trials that led to the approval. Tell us a little bit about what that study looked like and what the FDA finally learned that you have always known about the value of this technology.
So it was a large study. We had 88 patients with 3 different centers spread across the United States. And what the FDA was looking for are different signs and also for adverse events. And if we could show them that there weren't any serious adverse events and that we could improve some of the signs of dry eye, we could get the approval. And that's what happened. So long-term IPL treater will know that this actually works and patients do really well. And then we had to prove that to the FDA so that we could get the approval.
Fantastic. So the safety and the efficacy finally, I think, has been validated by the FDA.
Very important to do.
Great news. So here we are now, Optilight. Give us a little tour here. Show us some of the features, some of the innovations that really set Optilight apart.
What I love about Lumenis as a company is that they don't rest on their laurels. So they continue to improve and evolve the technology so they make it easier. So they listen to what the doctors had to say in terms of making it better and incorporating those improvements into this Optilight. So one, doctors who have never done IPL before wanted an easier, straight out of the box way to use this effectively and get the efficacy that you and I get. So one of the things is once you get out, all you have to do is choose the patient's Fitzpatrick type, and it tells you the energy and everything that you're going to use. So you can actually just use this right away. Amazing. Then the other thing is taking into account ergonomics. So all patients are different. Their face is different, even ethnicities, their faces are different, and then doctors are different. How do we actually apply this treatment if you're shorter or taller, or if the patient has a different face? So what we have is 2 different hand pieces, one hand piece small so you can get into the areas where it's difficult to get into to treat, and then a larger handpiece so that you can cover more area and get the treatment done. Yeah, and you know, the smaller OPT handpiece is so brilliant. Now we have a handpiece designed specifically for the tricky contours of the periocular region. I mean, that's exactly what we've needed. Exactly. Dr. Toyos, not only do you actively treat ocular surface disease in your clinic, but somehow you manage to find time to be a busy cataract and refractive surgeon as well. And we as doctors have come to learn that managing the ocular surface around surgery is critical if we're going to get the best results possible. Tell us a little bit how you incorporate technology like this into the management of the disease state. So when I talk to surgeons and I talk to them about dry eye disease, I tell them if you want to be the most effective surgeon that you can possibly be and have premium results, what you're going to have to do is treat patients with dry eye. There's plenty of studies showing that as you get older, your risk for dry eye increases. So if you're a glaucoma patient, a cataract patient, a retina patient, you may need that type of treatment before you get into the OR. Right. And if you want the best results possible for that patient, you want to treat dry eye disease. LASIK surgeons, all the time, this is something that they're dealing with before and after. So something that you want to do is treating these patients who are going to have a LASIK procedure or SMILE and treating their dry eye before they actually go into the operating room so you can maximize your results. So it's very easy to tell these surgeons, if you want to be the best surgeon that you could possibly be, you could do great surgery, you could pick the right technology, you could pick the right lenses, you could do all the right things, but if you're not treating dry eye disease, you might get bad results.
Amazing. Very true. And who doesn't want to do our best surgery possible? And what patient doesn't want to get the best results possible? And one word that I've heard you use in the past is the idea of premium, the premium outcome, the premium refractive outcome. Let's face it, we think about premium cataract surgery, premium lenses, and now it's time that we also start to think about premium ocular surface care. And together, that's the way to get probably the best results.
So we're improving on technology and all the things that we're doing. We're improving on our cataract technology, we're improving on our LASIK technology, we're improving in our glaucoma technology, and all for the purpose to get patients the best results and the best vision. Well, now we're improving our technology in terms of treating dry eye so those patients can get those results.
Perfect combination. Dr. Toyos, what a pleasure seeing you today. Thank you so much for stopping by and enlightening us this. Don't go too far. Change up, because you're going to be demonstrating a live treatment in just a moment, right?
Great being here.
Can't wait. I am sincerely excited to bring out our next expert. There are many doctors out there, but there are very few doctors who have mastered both the art and the science of dry eye disease. Our next guest has certainly mastered both. With a scientific mind like a turbine engine, I'd like to welcome to the stage long-term colleague and friend, the founder and medical director of Periman Eye Institute and the one and only dry eye master, Dr. Laura Periman. Hey, how are you? Good to see you.
Nice to see you.
Welcome. Exciting day here.
Yes.
Dr. Periman, I have so much admiration for both the breadth and the specificity of your scientific knowledge around the pathophysiology of dry eye disease. And I couldn't imagine a better expert sitting here right now to answer these questions. Because let's face it, we have a lot of doctors out there who are thrilled with what they've seen regarding the technology, but they want to understand the scientific basis. They want to know it's going to work and that it makes sense. Give us a little bit of information on why Optilight is well suited to manage dry eye disease, the signs of dry eye disease.
We've got this huge population, 30 to 50 million Americans with dry eye disease, and 86% of those have a component of Meibomian gland dysfunction. So we've got this huge problem that has an inflammation core to the problem in a double vicious circle fashion, right? There's aqueous and evaporative. We don't divide it anymore. It's yes and. They're on top of each other in a double vicious circle.
Right.
Yes. So we've got this complicated situation that we now want to treat as simply and elegantly and efficiently as we possibly can. And with the Optilight system, we're able to address many different aspects of that double vicious circle. So for example, the telangiectasias, we have all kinds of clinical papers using the Lumenis with OPT technology, IPL, lowering the telangiectatic vessels, decreasing inflammation. There's amazing confocal microscopy paper showing that the caliber of the Meibomian glands improves with just 3 treatments. The quality of what's inside improves in their reflectivity, and the activated T cells surrounding those Meibomian glands drops off with just 3 treatments. It's absolutely amazing to see these images, these ultrastructural changes from the IPL with OPT systems. So now we've got this, and not only do you have that ultrastructural change, but now you have a reduction in the cytokine load. And you know how I love my cytokines.
Yes, you do. I know.
You have this powerful way of decreasing the inflammatory burden, and that has some ultrastructural benefits. We start to see improvements in Meibomian gland expressibility. We know that meibom is abnormal with MGD. It's one of the hallmarks. And you're able to see these improvements in the quality and the composition of the meibom over time. And it's so satisfying to take somebody from thick, turbid, abnormal meibom and seeing a much more normal meibom at the end of the treatment series.
Amazing. Yeah. I love the way you described it. I probably retained about 10% of your knowledge, but you know what? It certainly gives us a lot of confidence that when we're using the system, we're actually managing the pathophysiology of the disease. Yes. I heard you mention meibom quite a bit and meibomian glands. I know some of us are wondering, should meibomian gland expression be a part of the treatment protocol?
Right. So with the Optilight system, it's a series of 4 treatments spaced 2 to 4 weeks apart, followed with expression. So it's typically done with expression.
With expression?
Yes.
Okay, very good. Now, still, many doctors, probably like myself, who are trying to retain some of this very valuable information, are also thinking very practically. There we are in the office. We're trying to figure out if we have a patient who's well suited for Optilight. Give us a little guidance about how do you identify an ideal candidate for Optilight? What do they look like, and where in your algorithm does it fall? Do we have to save this till nothing else works, or is it something that we can consider in the beginning or many places along the algorithm? What do you think?
Oh, I love that question. And really, the Optilight system is indicated for moderate to severe dry disease with Meibomian gland dysfunction. So I think we need to be looking for that moderate patient before they become the severe patient. And really, when we're talking about IPL technologies, it's a TFOS DUS 2 level 2 recommendation.
Early.
So it's earlier than people think. Why
Right.
wouldn't you? Especially with addressing the inflammation, seeing the improvements in the Meibomian gland expressibility, improvements in tear breakup time. You see this again and again and again in the peer-reviewed literature around the Lumenis IPL system with OPT technology.
Absolutely. Dr. Periman, obviously we are very excited about this technology, but as doctors and clinicians, we always have to be mindful of the balance between benefits and risks. Talk to us a little bit about some of the potential patients we should be cautious in, some of the potential contraindications and risks that we need to at least be aware of before we recommend Optilight.
Absolutely. So with the Optilight technology, you'll want to focus on your patients with a Fitzpatrick skin type of 1 through 4. You'll want to make sure that your patient has not had eyelid surgery or surgery around the eyes within the past 6 months. And of course, nobody with an active infection of the face or the eyes, and any history of perioral HSV. You'll want to be, those are contraindications. As far as side effects are concerned, there's temporary discomfort, there's hypopigmentation, hyperpigmentation, as well as prolonged edema. But I gotta tell you, there's so much technology packed into this that it's a wonderfully safe platform, wonderfully safe technology. We always have to be aware of what those potential side effects can be.
Absolutely. That's one of our most important jobs as a doctor, is to always be aware of course, those benefits and risks. Makes a lot of sense. But thank you so much for joining us today. I mean, I've learned so much in this short period of time. I wish I had all day to chat with you. I know I'd be a lot smarter if I did. But thank you, Dr. Periman. This has been very, very insightful and helpful.
Always so great to hang out with you, Dr. Adler. Thank you.
Fantastic. And now let's return to Dr. Toyos, who is about to perform an actual live Optilight treatment on one of his patients.
Hi, I'm back, and I'm going to demonstrate to you the Optilight with the 2 handpieces. We have Stacy here who's acting as the patient. We're going to use the first handpiece to treat from trachea to trachea here in the difficult areas, and that's why we're using the smaller handpiece. And then we'll switch, and I'll show you how to do that, to switch to the larger handpiece to treat the rest of the face. This is going to be a sham treatment, so normally I would do 2 passes right here in this area with this handpiece. For this sham treatment, I'm just going to do 1 pass. And then once we do that and I show you this handpiece, then we're going to show you the larger handpiece. So this is Stacy, the patient for today. And usually what I tell patients is that essentially what you're going to do is you're going to see a flash of light. You may feel a little bit of heat, and it's going to feel like somebody is touching your skin. Then you put on your safety goggles here to protect your eyes. And we're going to go ahead and start. So this allows me to get in areas that I wouldn't be able to get to with a larger handpiece. And then what I have the patient do is just move here so that we can get exposure to the areas that we want to get to. And now with this larger handpiece, we can go to larger areas because we've already treated the hard to get to areas with the smaller handpiece. Again, moving, and then I usually ask if the patient's comfortable. How are you doing?
It's very comfortable.
And now you see that I'm going trachea to trachea here with the treatment. And normally we would do 2 passes. And again, you want to start at the 1 spot where you started so that you can get some thermal relaxation time going from one area to the other on the second pass, starting in the same spot that you started the first pass. One thing that you'll notice is there's a cooling that's happening on this handpiece here, so we're not heating the epidermis or doing any kind of burning of the epidermis. That makes it more comfortable for the patient, lets the patient recover a lot quicker so that you can do treatments every 2 weeks to get through the 4 treatment protocol, which was what we used for the FDA study. And then I would go and I would give her another treatment and another pass. Some things to consider. Usually in our clinic, the patient's already prepped for me. I'm coming into the room, they're ready to go. Stacy, I've finished the treatment. I would tell the patient that one of my technicians is gonna come in, clean them up, and that I will be back to do Meibomian gland expression. I'm really excited to have this option in our clinic for our patients. This is an incredible advance and revolutionary advance in the treatment of and management of dry eye.
That was amazing. Dr. Toyos, thank you so much for sharing with us your insights into the efficiency and the effectiveness of some of these new tools with Optilight. It's so important, and as much as we as doctors care and love the importance of new technology, in the end, we always have to remember that there's a patient, there's a person behind those eyes. And what's amazing is that Optilight can not only help us improve the quality of the ocular surface, but it can also help improve the quality of a patient's life. Now let's actually turn our attention to a real patient, a patient who has undergone Optilight. With us today is Chelsea. Thanks so much for joining us.
Thank you for having me. I'm Chelsea Smith from Phoenix, Arizona, and I'm so happy to be here.
Very good. Chelsea, you have a really important story that doctors should listen to. You were somebody who suffered from dry eye. It affected you in many ways. Tell us a little bit about how dry eye impacted the quality of your life before you underwent Optilight.
So dry eye impacted my life just on a daily basis for several months. It was continually getting worse. I was having a lot of blurry vision. My eyes felt really dry all the time. I had a lot of itching, and then my eyes would hurt. They were very sensitive. I had a lot of tearing at night, where like tears would just like be rolling down my cheeks.
I'm sure, and you were a contact lens wearer as well, correct?
Yes, I was trying to wear contacts all through this, and it just got more and more difficult to the point where I couldn't put a contact lens in my eye. It was just very uncomfortable for me.
You've hit upon some of the really key issues that patients with dry eye face, both issues of comfort, of clarity, of contact lens intolerance. But surely you had tried some other traditional therapies before Optilight. Tell us a little bit about what those previous treatments were and why they proved insufficient to fully manage your symptoms.
Yeah, so the other therapies that I had tried that proved insufficient for me ranged from eye drops to warm compresses. I took a lot of fish oil, tried to stay hydrated, drinking water. I had a humidifier, and none of those really made that much of a difference, enough to really impact my day-to-day life.
Right. And so many patients are looking for an alternative, sometimes ways other than drops to manage their disease. But also some patients wonder, my goodness, what's this experience like? Is it painful? Is there recovery? Is there downtime? Tell us a little bit what the experience of receiving Optilight was like for you.
The treatments are very, very fast. It doesn't take a lot of time. I was in and out of the doctor's office in probably 30 minutes. The treatment itself is like no more than 5 minutes, if I had to guess. There's like a protective covering over your eyes, and I just kind of, had my head tilted back and my eyes closed. It felt like I was laying in the sun. It just felt like a rubber band just kind of snapping on the cheekbone and just around the eye. It went very fast. Afterwards, I would put sunscreen on before leaving the office because I live in Phoenix, Arizona. Then I could resume my normal day-to-day activities.
Amazing. Yeah, and that's so true, because sometimes patients are worried, my goodness, am I going to be restricted from doing certain things afterwards? But from your report, it's clear that people can pick up with their life. It's not an inconvenience. It fits into their schedule very nicely. But I've got to ask you, we're all wondering, so now that you've had Optilight, how has life improved? What's it like now? Has some of the symptoms and some of the concerns you had, for example, with your contact lenses, are you now more successful? Do you feel better?
Oh my gosh, yes. So my experience coming off of the Optilight treatment has just been incredible. I'm now wearing contacts every day for the majority of the day. I'm not having the itching or the sensitivity. I rarely have tearing of my eyes, and I feel like I'm just back to life as normal.
My goodness, you're back wearing your contact lenses. That's great. What a wonderful success story you've shared with us today. I know you've inspired me. You certainly would inspire some of your friends who learn about Optilight, and hopefully you've inspired some of the doctors who are watching this show right now. Thank you, Chelsea. Thank you so much for joining us today.
Thank you for having me.
Many of you, I'm sure, are starting to feel confident in the science and the technology, but are wondering, how can I be successful in my practice? Well, our next expert guest will help us with that question. He is an expert not only in dry eye disease, but in practice management as well. I'd like to welcome to the stage from the Dry Eye Center of Arizona and the co-founder of Phoenix Eye Care, Dr. Art Epstein. Dr. Epstein, so nice to see you here.
Pleasure.
We need you. Come on over. We have to talk.
I am looking forward
This is a big day. Listen, there are a lot of folks listening right now who feel really good about the technology and are really excited about the science, but they're thinking to themselves, can I be successful? Is my practice going to become successful with Optilight? For those folks who are having those kind of thoughts right now, what advice, what kind of guidance can you give them?
Well, like most things, success is in your own mind. You know, if you think you're not going to be successful, you won't be. If you think you are going to be successful, you're more likely to be. We've had Optilight for just a few weeks. It's a recently introduced system. Optilight has been an incredible journey for us, an incredible experience. As many of my colleagues know, my practice is limited to dry eye. We have a lot of different technologies in the office. When we embraced Optilight, my expectations were that it was going to be a significant addition. Well, it completely exceeded my expectations. So much so that we've literally managed to change patients' lives. I mean, I've had patients that were so difficult to manage, patients post-chemotherapy, you know, the types that are really, really difficult. Optilight has really been a godsend for these patients. It's also changed the very nature of my practice. Patient satisfaction has gone through the ceiling, which has created a referral base, patients talking to other patients. It's been phenomenal. It's really been amazing.
And that's great. And you know what? And people love to hear these kind of things, that if patient base is growing, word of mouth. Dr. Epstein, some of the most successful examples of practices that have incorporated Optilight are optometric practices. I've seen so many wonderful examples of that. Still, there are some optometrists who are a little bit cautious. They don't want to be the first. They don't want to be the last. But they're still trying to figure out, does this fit into the scope of my practice? How would you counsel those optometrists, and how would you encourage them to see that this not only fits within the scope of their practice, but may actually improve the scope of their practice?
That's a great point. Well, now that Lumenis IPL is approved by the FDA for the management of dry eye, I think we'll see more and more state boards coming online. The majority at this point already allow IPL within the scope of optometric practice. You raise another issue, which is more important, is it within your scope? In other words, do you feel comfortable with it? Optometrists sometimes forget that procedures are an important part of optometric practice. Ophthalmologists have recognized this a long time ago. A lot of ophthalmology is procedure-based. More and more of optometry will become procedure-based, and to me, Optilight was a direct pathway in that direction. So, you know, I kind of enjoy being able to modify a patient's structure and function with something I literally hold in my hand. It's self-validating, it's fulfilling, it changes patients' lives. So for my colleagues who are thinking, I don't know if I can do this, I don't know if it makes sense, not only does it make sense from a patient management point of view, but it also makes sense from a return on investment point of view, because it's probably been one of the most successful additions to our practice from a technology point of view.
Because let's face it, we don't want to spend any money on innovation that's going to slow us down in the office. And from what I'm hearing from you, scheduling these patients is really easy, and they actually fit into the flow of your day without interrupting patient care.
Right.
So what does it look like? How do you evaluate a potential patient, and then do they come back another day for treatment? Yes. What does your flow look like?
So you hit the nail smack on the head. Patient flow is critical. I think the success with anything, especially in a specialty practice like dry eye, So we were able to increase our throughput, and now we see 24, 25, even sometimes 30 patients a day for Optilight treatment.
You're kidding?
I kid
That's
you
a lot.
not. And we've condensed the Optilight treatment into 15 minutes. We
Amazing.
literally, from start to finish, patient comes in, patient comes out. We just process them through very, very carefully. They feel well cared for. The technology is game-changing for them. They feel improvement after 2, 3 sessions, and it's kind of self-fulfilling. It's an amazing experience.
Very true. And I think you hit upon what I sometimes think of as the 3 E's in order to be successful with innovation. And that's the idea. It's got to be effective, it's got to be efficient, and it's got to be economical. Dr. Epstein, let's face it, companies come in and out of our practice all the time and talk about ROI, ROI. We hear it. Why should doctors, prospective customers, doctors who are thinking about the Optilight system, why should they feel uniquely confident in the potential, in the return on investment for Optilight?
Well, Optilight is essentially the gift that keeps on giving. You know, if you're looking at it from an economic point of view, the cost of engagement is quite reasonable for technology this sophisticated. The fees we charge for patients, I think, are reasonable and fair, accessible to the majority of patients. The results are so impressive for most patients that they really have no issue with paying those fees. You don't have to be a mathematician to do the math.
Wow.
This pays itself off in literally months.
That's amazing.
I mean, this is remarkable technology. It literally changes the way we interact with patients. It changes the way patients experience their environment. They have less symptoms, their Meibomian gland function increases, tear stability improves. Patients have very, very real benefits. I mean, they feel those benefits. If you believe in that and you see it, it drives you on, and then you become almost evangelical about it. You know, you get excited about it, you get the patients excited about it. They tell other patients, and that really builds a practice.
I love it. I believe in the holy tier. Don't you? Very nice.
Very good.
I've got to ask you though, the part that you said about the emotional connection, that really resonates with me, because let's face it, the more confident we are as doctors, the more confident our patients are going to be. That kind of confidence is contagious, and I certainly believe in that. Thank you so much for joining us today. This has been invaluable. It's been a great pleasure to chat with you. There are so many doctors who have bought into the data, bought into the science, and now they're ready to buy into the success.
Great.
And you've been a big part of that. Thank you. We're going to bring Dr. Periman back out now to talk about a few more questions that our audience members are bringing up. Dr. Periman, come on back out. Welcome back.
Hi.
So glad to see you. You know, we have covered a lot already today. We've discussed the technology, we've discussed the science behind the pathophysiology, we've even discussed practice management. But there are still some questions that I think the doctors out there are wondering about. You know, many doctors wonder, how can I really be maximally successful with Optilight? And one of the keys is communication. It's such an important part of the process. Doctors have 3 chances to say the right things before, during, and after this treatment, essentially. So I'm wondering, from your perspective, what do you find is some of the most important details to communicate to a patient in the exam room as they're thinking about Optilight? Dr. Periman, what do you think?
Well, I think communication is critical, as you pointed out, and I love your way that you approach it before, during, and after. And so I think before, it starts with understanding the science of what's happening, understanding the mechanism of action, understanding the disease state, and then communicating all that to your patient in a simple way, such as, you have dry eye and Meibomian gland dysfunction, but it's a busy, noisy, messy disease state, yet it doesn't have to be difficult to treat. There's easy ways that we can adjunctively address your multiple problems.
Absolutely, I love that. And I love the idea about simplicity. I think simplicity is critical to this. And how we explain it, how we explain the technology, the treatment, what to expect, simplicity works well.
I have a foundational therapy that I apply to most patients, you know, the typical nutritional and so on. I basically explain what my expectations are. I explain that it's a holistic approach. It's the application of light, which is an envelope for energy that can transform function and their experience. And explain to them that, you know, I think we're going to end up there. And if they want to get things moving quickly, let's set it up now. And a lot of patients say, you know, I'm ready to go.
Ready to go.
And I share share a little bit of the anecdotes from some of the more successful patients I have, which is a lot of anecdotes from a lot of successful patients.
I bet. I mean, and it's such an important part of this. Reassurance and setting expectations have to be a part of what we do before, during, and even after the treatment to make patients really feel confident and comfortable with their results. It's really critical. Dr. Epstein, another comment I hear sometimes from doctors is they need some help marketing. Doctors are looking for advice. What can you tell them about some strategies that the doctors, the practice, and even Lumenis can help them with marketing?
Well, Lumenis has been great. So when we first got started, again, we dived right into a pool, and we didn't know what was in the pool. Lumenis made it a lot easier for us. We had tremendous presence from our rep. We had marketing materials. We had online social media assistance as well. But I think to your point, the key really is understanding that the patient is in your chair for a reason. And whatever your algorithm is, whatever your protocol is, Optilight can be a game-changing experience for the patient. So part of the process is, I think, believing in it. The more experience you get, the more success you have, the more you believe in it. And that becomes an extremely valuable marketing tool, a very powerful marketing tool. When you explain anecdotally some of the experiences that you've had, patients really want to engage.
I agree with you. Sometimes a doctor's confidence in their experience and in the technology is really contagious and is very, very effective in moving patients towards treatments that they might not otherwise have thought of.
Precisely.
Dr. Periman, you are well known as an innovator and a person who continues to innovate in around the technology and around technique, and you have come up with many ways of optimizing Optilight. But for folks who are out there who haven't had that kind of experience and are wondering, how am I going to get caught up to speed? How am I going to get trained? How can you put people at ease that training is a part of the Optilight experience?
You have to trust that the training is there. They provide this wonderful clinical training program so that you get set off with good habits from the get-go. It's an incredibly simple platform to use. There's wonderful user interface. And then the techniques are things that a lot of our colleagues already have, a lot of skills they already have. And it's just a matter of learning to operate the system in the context of the techniques that you already employ. But once you get those basics and get those good habits started, then you can expand from there.
It's true, and that's the part of the beauty of the system, is that it allows for easy adaptation and innovation to different clinical scenarios and for customizing your care. I absolutely love that. Just a real quick lightning round question here. We got about a minute left. A lot of times people ask about retreatments. Are my patients going to need another treatment? How do you advise patients who are asked, Doc, am I going to have this again in next year? Or is it going to last me for the duration of my condition? How do you respond to those folks real quickly?
Actually, a great question. And that is a very common question from patients. And it varies. We have patients that come back literally every month for a treatment. We have patients that go for a full year, some that have even gone longer. So it varies. And I explain, as you said, it's very customizable for each individual. We track them. We use diagnostic technology to see when things are going awry, and then we treat them. And they like it because generally they get significant benefit from it.
I like that. Yeah, I mean, and setting expectations is really important. What kind of expectation do you set for your patients regarding retreatment?
So from the beginning, the before, during, and the after, and I explain to patients, expect an induction series of approximately 4 treatments, and then once or twice a year after that, depending on the level of control and the other adjunctive therapies that we are employing for you, that determines the retreatment rate, and I just leave it open for the patient. You'll notice when things are not doing quite as well, that's the time to come in for a touch-up treatment.
I like that. That's a really good way of phrasing it. Well, thank you guys very much for joining us. That's been very informative. I know I'm excited just sitting here listening to you. We've talked about the technology today. We've talked about the patient clinical experience and even practice opportunities. But now everybody wants to know, hey, when and where can I actually get the Optilight? So for that question, let's turn to our leaders here at Lumenis.
Wow, such an exciting event. We hope that you're as excited as we are. The system is actually available now, so don't hesitate, don't waste any time. Contact us here below and the Lumenis rep will be in touch with you. We at Lumenis want to make sure that you're successful, and not only that your patients are benefiting from our technology, but we want to make sure that your practice thrives. As soon as you purchase the system, we would offer enhanced training on Optilight as well as extensive marketing support. But not only that, the first 25 doctors who would purchase the system would get the premium marketing package from Lumenis that would include Google AdWords, website support, white glove service, and so much more. That package is worth $6,000, and again, it would be offered for the first 25 doctors who would purchase the system. Contact us here below, and we would love to work with you.
Well, well, that was a fantastic conversation today. I want to personally and sincerely thank our expert panels, Dr. Toyos, Drs. Periman, and Drs. Epstein, as well as our model patient and the entire Lumenis team for this fantastic conversation today about Optilight. Optilight has transformed IPL with its novel handpiece designed specifically for the tricky contours of the eye, and with optimal pulse technology designed specifically to emit that even, continuous, and comfortable amount of energy to the eye. IPL will never be the same. And with the ability to drive an additional source of revenue in our practice, the value is immediately realized. So in the end, ask yourself these questions. What ways other than pharmacology do you have to manage the inflammation on the ocular surface? Do you have patients who don't use drops well? What else is in your toolbox? And why would you want to treat downstream when you can be treating upstream? Why stay in the dark when you too can become a part of the light? Welcome to Optilight.
Light, Earth's greatest source of energy, source of life, source of all shapes and colors, and a source of healing. Meet the first and only IPL FDA approved for dry eye management. Introducing Optilight, a bright solution for dry eyes by Lumenis. With patented OPT technology, light energy is applied with maximum precision and comfort, making every procedure brighter than ever. The healing power of light is now in your hands. Optilight, a bright solution for dry eyes by Lumenis.